Be intentional. Take action now. Welcome to the Humanscape podcast, where we help business leaders develop the cultural landscape for tomorrow's success. In a world that is wobbly, we're here to help you create a strong cultural foundation for your business. And it's all about bringing your values to life, elevating people to perform at their best, creating a strong strategic plan, and offering lifelong learning opportunities. Are you ready to bring work to life and life to work? We are. Let's talk. We're back with another episode of the Humanscape podcast from HumanWorks 8. In a world that's constantly changing, it's essential for business leaders to understand how to bring work to life in their organizations and life to work for their people. I'm Shawn. I'm the thought catalyst with HumanWorks 8, and I'll be your host for today's conversation. In just a few minutes, you'll hear from today's guest, Julie Preder from Mental Health America Lakeshore. But first, here's a little bit about Julie and Mental Health America. Mental Health America is the nation's leading nonprofit dedicated to promoting mental health, well-being, and illness prevention. MHA works to close the mental health equity gap through advocacy, public education, direct services, and research. Julie is the executive director of Mental Health America Lakeshore, one of two MHA affiliates in Wisconsin. Based in Sheboygan County, MHA Lakeshore empowers the community with education, resources, and tools while connecting individuals to the best local support for mental wellness. Julie, I love this, considers her career a gift, an opportunity to serve others. Passionate about promoting mental wellness and reducing stigma, she works to normalize conversations around mental health and empowers individuals to share their stories and uncover their strengths. A dedicated advocate for social inclusion, Julie is committed to addressing the social determinants of health that create barriers to care. Through her leadership, she implements strategies that foster greater access to support, helping individuals live their best lives. Julie.
Hello.
Welcome to the podcast today.
Thank you.
Julie, we know that MHA Lakeshore's impact goes beyond what was just shared. Is there anything else that our listeners should know about the great work you're doing in the community?
Yes. So first, thank you so much for having us and highlighting the good work that's happening within Mental Health America. I want to add that we're one of 144 affiliates across the nation. So there's a saying, when you meet one affiliate, you've met one. So we're all doing something a little different to raise the bar, that platform for the conversation around our mental well-being, identifying and understanding what signs and symptoms are for mental illness and co-occurring disorders. And how do we make sure that there's parity for all when we're talking about our mental health? We know if you go to the emergency room and you break your arm, you're going to get treated for that. But if you're going into the emergency room and you're having a mental health crisis, you're not necessarily getting treatment. Most of the time, you're getting turned away with a safety plan or maybe medication, or you're being stabilized, whatever that looks like. And it's important that we have these discussions because mental health is health. We have to have mental health. And what we do within our affiliate, which is around the region of Sheboygan and the Lakeshore and in rural communities, we bring programming to our communities around community, youth, workplaces, and how do we provide that literacy piece around education and programming, but also how do we access services and how do we do it in a way that everyone has the ability to understand what their resources are and how they navigate a very complex system. It surprises me how many times I talk to professionals within the field and they're having a hard time moving through a system. So this organization and one of the affiliates across the nation, those 144, were all working along with partners to get individuals into the care that they need.
I love that, Julie. And there's something you said, I'm going to come back to it. You said mental health is health. And I love how you sort of did the analogy to like a broken bone. And up here in my head, one seems it doesn't happen very often, but just our mental health is constant. It's kind of like a constant. And I'm not saying as well as I know you can say it, but you see that went right to my head, Julie, how, we put a focus on this one-time thing where mental health is just ongoing.
Yes. When I'm talking with workplaces, if somebody's in a car accident and they break bones and they're in the hospital and they're coming back and they have accommodations of how that work looks like. But we're not necessarily doing that for an individual that may have had a mental health crisis. What does that look like when an employee comes back? How do we make accommodations for somebody to integrate back into their job? We invest all this money in employees. How are we not having the conversation within a workplace around one's mental well-being?
And we're going to dig into that more, but let's find out first a little bit more about you, Julie. Are you open to that?
Sure.
We call it the three parts of Julie's mind here, and we're going to start with your cognitive part of your mind, your intelligence, and what we like to find out for our listeners get intrigued is what's a hidden talent, skill, or Julie, what's something that you're smart about that other people may not be aware of? And it could be in your field, or it could just be something in life. What jumps to mind that way, Julie?
One of the things that I love about this work and what drives me, and I think from a very young age, I was identifying the bigger picture within an individual. What makes somebody do the things that they do? You look at somebody and they may be labeled bad because of their behavior, but in the end, what is the action and what is linking that behavior to their past experiences? And I have had this from a very young age. I'm just very attuned into what's going on with an individual. And, it's no surprise to my family and friends that I ended up in this field. It's what drives me, but also it's my passion. I want to know, what is your story? How did you get here? And why are you doing the things that you're doing? It's what drives me.
I like that, Julie. And you sort of led right into that second part of your mind. It's how you feel and a little bit about your affective personality. And you mentioned a passion, and that's definitely effective. You're just passionate about people that way. I'd love to intrigue our leaders that are listening a little bit about, we're talking about well-being and mental well-being. Do you have a favorite way or activity that helps you just recharge or get balance back? Does anything come to mind that way, Julie?
Well, I'm going to go personal with this. I love supporting live music. It's something that feeds my soul along with food. So the two together for a great evening or a day activity or a festival, my husband and I seek them out often. And we just were at a concert just this last weekend supporting live music. So that is something definitely that charges me and also just continues to drive my self-care.
I like that. Is there a type of music or
everything? It doesn't matter. I love it all.
I was feeling that from you. I have the answer to follow up, but I was feeling she's going to say everything. And she's just out there soaking in that live music. I love that. And the third part of the mind, you and I have a little bit of a connection because you actually learned about this third part of the mind through Colby Strengths Week, working with Human Works 8 and Sarah. Isn't that right?
Yes.
Yeah, and that's that instinct. So, Julie, if you just have your freedom to take action your way, how do you like to jump in and start doing something? What gets you in the zone or in the flow?
I'm definitely team oriented. And it's interesting, after we did our assessments and we came back, I definitely stood on the outside of my team, which, as a leader, and I believe hiring people that are smarter than you and that are going to drive whatever you're doing. I love that we're very different because in the end, I'm that person who doesn't want to adhere to any procedures. I'm just sort of out of the box. I'm all over the place. And my team brings me back. So when we start projects, we have a list of questions that we go through. Is this something that we want to do? We have things coming to us on a daily basis, partnerships, events, whatever that looks like. And as a team, we're discussing, does this fit within our strategic mission? And do we have the capacity? But we get to know what everyone at the table is thinking about that. And I think going through the Kolbe assessment, it really honed in and it was transparent for us. We can honor what all of these traits look like and feed off of it. We see it now. It's sitting at the table for us, and we can continue to look back at that. If anything comes up where we're questioning why the team isn't working in the way that it needs to be.
And we're so happy that you were able and grateful that you were able to take advantage of that Kolbe Strengths Week. We do that every year and are always looking for organizations that are looking at, like you said, how do you really celebrate, look at, and be able to sort of look at the team and find how do we work the best? How do we utilize you mentioned differences, which is a strength on it. You need to do that. When you said you stood aside, when I heard that, I thought, oh, her result must have been a little different than everybody else's. So she was kind of, how do I work with all these other instincts and the way they work? When you went through that, is there anything you would say when you think about that instinct that you remember?
It's interesting because, we had some issues prior to taking that, and it came down to communication. I think there was some resolve, not all resolve, but there was some resolve with a lot of the issues that had come up in the way that perhaps me as a leader, bringing that information down. For me, it was a lot of individuals within my team needed consistent feedback on this, not just a one-time, hey, this is what needs to happen. I need to circle back and actually dig in a little bit deeper. And it's a work in progress. It always is, especially when it's standing, for me as the leaders, what my skills are and what my traits are necessarily don't fit with the way that this team currently needs to hear feedback. So it's work on my end to make sure that I'm doing what I need to do, because the majority of them are the complete opposite of how I work. And thank goodness, because maybe we wouldn't get anything done if it was all like me. So,
well, and that's how I second that mostly, Julie. I like to surround myself with instincts that are not mine, because I need those. You said it sort of your team brings you back. They kind of help you then settle or give that strong foundation when you can really honor and celebrate those differences. Using the Kolbe assessment to aid in elevating communication, I'm glad you brought that up, because it can really help that way. And I think sometimes we think everybody will say, hey, we all communicate and want different things. Kolbe really helps people sort of put that into words. I need this. This helps me. You know what I'm saying? And so I'm glad you brought that up. And I'm glad you're part of our Kolbe family that way, Julie. I want to move to your values. As an organization, we focus a lot on values and how those are foundational to organizations and how you use them. And MHA Lakeshore's values of compassion and hope and resilience and education and community, really strong, powerful words that way. And I'd love to hear, does one of those jump out at you right now that you're saying we're really focusing on this or talking about this value a lot?
Well, community for sure. And it was our theme just this last year, and we're carrying it into this year, which is that connection. We know right now one of the biggest public health crises is isolation. And you don't necessarily have to feel isolated to have a lack of connection also. So much has shifted since COVID. And we were just having this discussion the other day, doing this one event. How do we get people out? How do we get people to engage in what our offerings are going to be? How are we connecting and taking care of one another, which sort of leads into this other value, which is compassion and understanding. And in this world of political unrest right now, and as we're shifting as a nation into another way of thinking and doing business, no matter where you sit, there's an understanding that needs to happen with empathy and compassion in order for us to continue to move forward as humanity.
Community and connection through compassion. That's what I hear, what you're talking about. And that, of course, aligns really well with one of our truths about everyone connects and just the importance of building that trust support through community. A lot of our leaders, they know that, Julie, but they're saying, okay, what insight, what do I do that can strengthen connections and building that community with the teams? Anything you tried or anything you're thinking about or anything you like that might be a little bit of an insight or way to help leaders to take action in that area?
I'm a big fan of small groups and focus groups. I know big employers, a lot of it is surveying the teams and, you have thousands of people that you're looking at, really digging down into those departments and not necessarily those frontline supervisors, although they could be, but who are your champions within those departments to hear what other people are saying? Employees don't want to necessarily be talked at. They want to be heard. And that's something I say over and over again as we're working with companies. How are you listening to your employees outside of a survey? What does that look like at a staff meeting? And do you really want to hear the feedback? And what are you doing with it? Because people want to know, if you're asking me this question, then what's going to end up happening with the information that I'm giving you?
Yeah, turn it into some actionable steps if you're looking for that feedback. We work with organizations that also focus on employee resource groups, and that's a powerful way for enhancing connection. Have you seen any way that those groups can be used better, differently from your perspective in organizations and people you work with?
Yes, I'll use two examples. Big corporations here within the Sheboygan area, Kohler and Volrath, they both started employee resource groups around mental health. Kohler has several hundred people involved in their Heads Up employee resource group. And we were there at the beginning with them. They leaned on us in partnership to provide that learning piece. What does it look like to really understand the landscape of what mental health is? What are the issues right now? And how do we bring that into initiatives within our company? And they've gone on to do walks, campaigns. They do a lot of give back programs for organizations that are focused on mental well-being within our area. The same with Volrath Company. This is a big manufacturing company that runs 24 hours, and they started an employee resource group called Minds Matter. And they did a video with lived experience stories to really unveil what they were doing within the company. And I sit and look at both of these companies. I'm so proud of them saying, yeah, mental health matters within our company. It matters so much that we're willing to put dollars behind a resource group that will push forth initiatives and campaigns within our company. So those are just two examples of leading by example and really making sure that you're putting some meat behind what you're saying you want to do for your employees.
Working with organizations, I don't hear of a mental health resource group. A lot of other ones, but not that focus. And I love that as an idea, as a way in. Start there. Do you know what I'm saying? Start there and get some heads around it. And who knows what ideas or strategies might come out that you can utilize then in the organization. Julie, I want to go back to something you said as well when we were leading into the employee resource groups. You talked about, and I wrote this down because it's definitely going to be a highlight. You talked about, finding ways for people, not through surveys, but through actual conversation and talking. And, that's the way where you get at that. Are there any sort of great questions to use that way to get the conversation going? Where do I start around this mental health? And I would love some ideas from you, Julie. What question, what focus do you start just to get people comfortable, letting some information out or letting them giving their perspective on this topic?
For me, it's And I do this during all of my performance reviews, and I think it lends into those staff discussions. What drives you? Why are you here? Outside of the paycheck, people can go anywhere right now and work. But if people are heard, and study after study shows this, if people heard and feel valued within their workspace, they're going to stay. It doesn't matter if somebody else is throwing a bigger dollar their way. So how do you lean into those critical conversations? First and foremost, your leaders within a workplace should definitely have training around critical conversations and an understanding of what psychological safety looks like when people are disclosing. And that is outside of human resources. I think that's just an understanding that all human resource staff should have that type of education. But people are going to their frontline supervisors. They're also going to individuals within departments that they know that they can lean on. How do we make those individuals ambassadors? So going back to your question, what drives you to be here personally and professionally? What are some things that you need help with right now? What could be taken off your plate if you could pick something? It's leaning in a little bit more and digging into a very surface level conversation about how somebody is performing. But that's also telling that employee, hey, they really care about why I'm here and what is driving me to do the work that I'm doing. Those conversations will then lead into other, maybe a situation comes up on a third shift where there's no HR on staff at that time. There's, the vice president's gone, everybody's home except those third shifters doing that work. How do they know that somebody from the top is listening to them? And I think that's a very important conversation for Wisconsin, too. We have so many manufacturing companies here that are working 24 hours. Those people that are working those lines need to be heard, too. So all of these discussions can happen during any of those special moments at any time of the day.
You heard us talk about the cognitive part of the mind in today's 3 parts of the mind segment earlier in this episode. The only way to measure the cognitive part of one's mind is by taking the Kolbe-A index. The Kolbe-A isn't about personality or intelligence. It's about you in the zone, you adding your best value, you at your most creative, how you get things done when you're free to be yourself. At HumanWorks 8, we use the Kolbe-A as the foundation to our talent optimization work with clients to help individuals and teams get the right people in the right role, build confidence, strengthen relationships, and improve performance. Want to know your unique result? Take the Kolbe-A index and uncover how your mind naturally works for your best performance. Visit humanworks8.com/Kolbe, Kolbe, to learn more.
Great insights, Julie. We tie that back really challenging organizations when that question of what drives you. We talk about organizations' core values, but personal values, because those drive why I'm doing what I'm doing, when I'm doing it, and whether I love it or not. And if you can get that alignment across, that's a really powerful talk about connection piece. Do you see people talk about their personal values? Do you do any of that conversation?
I do. And I don't think it's being done enough, but those companies that are leading by example, that's part of their performance check-ins. Long gone are the days where people are spending 30 years at a company. I had a situation a few years ago where I had a staff member who wanted to apply for a job. She wanted this type of job and she wanted to move up in her career. And I felt so honored that she was able to have this conversation with me to say, this is what I'm looking at. I don't know whether or not I'm going to get it, but I really want to do this. And I knew this on a personal end about her. Was I sad to see her go? Yes, she got it. I was so happy for her. But those are the individuals that are going to drive your mission and values. That's what we want out of our employees. And they want to be heard and they want to be valued.
One thing you had said when we were talking before the podcast and just learning about each other, you had mentioned about when it comes to this culture and trying to make people belong, feel good, that's something that I'm still carrying with me. So I want to bring it out to all of our listeners. You said it's not about diagnosing a good culture versus a bad culture, but you use the image of planting seeds. And that's what it is. Culture grows. And I believe that totally, Julie. From your experience, what are those seeds that organizations, leaders need to be planting, thinking about, or sort of getting together to plant later? Because I don't think you plant them all at once. Yet it's a building, it's a growing process to build that cultural forest or a cultural flower bed. What comes to mind? What are some powerful learnings that you see?
So true. It takes so long to shift culture. And it's funny when you hear people say, well, I'm going to put this initiative together and, the culture is going to shift. And it takes trust too. Planting those seeds, which I do love to use. So thank you for bringing that up. If we really dove into whether it's leadership or employees or that mixed bag of everyone sitting at the table, depending on how big your organization is, if we could lean in and shift something here to make our work life or our personal life better, what would that look like? If we could do an initiative that could change, whatever it might be for this company, the way that we do our work, what would that look like? Really asking those questions of your employees to dig in, not guessing, or what the trend might be, because your company may look very different than what is happening. And I would say that I just think about nonprofit work. We're all meeting the needs of our communities in a very different way. What our fit is, may not be the right fit for the next nonprofit sitting next to us. But I need to question what that looks like from my employees so I can understand how to build that. And the same with a big corporation. If you have 3,000 employees, what could we do different? What would you do different here? And starting there from the ground to help build, whether it's benefits, time off, accommodations. I look at some examples and I ask a lot of companies, if somebody has a death in the family, a child, a parent, whatever that looks like, what does your grief policy look like here? And most people say, well, depending if it's a grandparent or a parent, or maybe 5 to 7 days, maybe. Okay, so what does that check-in look like down the road for that employee? How are we understanding as a whole how someone shows up and how your policies affect the way that their performance is? We have to move past this way of doing business, which hasn't changed a lot if you think about it, because almost everybody has the same standard answer on some of these things. Well, we give this and that. Okay, but we know now today that we don't grieve this way. And grief can last for years and people go back and forth in it. So that's just an example of when you lean in, you're going to hear things that you don't have a roadmap for within your policy and procedure and way of doing business. And are you willing to hear it? And that's the biggest question. If we're going to invest in this for a company, are we going to hear it? And I said that at the beginning, if you're going to ask these questions, employees want to know what you're going to do with it. So these employees build who you are as a company, as a nonprofit, as a volunteer organization, whatever it is, your mission to drive something for humanity. And I guess that's what it really comes back to. We're all human. How do we make this like we're together, we're connected in this?
Love that, Julie. We started with planting seeds, and I think you set up a great way. You sort of started with, companies say, oh, we're going to do this initiative. But they're just throwing seeds. You know what I'm saying? They're just like,
Right.
Where you said, and I'm going to keep your seed image going, first sort of till the soil by asking some better questions to know how deep, where that is. And I love that. And then you brought up the whole idea on grief. And I just want to shout that out. You said it so well, like, that path, there's not one path. There's not a way to do that. But I want to shout out, it's not about number of days, organization. You know, isn't that funny? You can point to the policy guy. Yep, we got it. And it's all about number of days based on relation. And even, our families are so different and people are, so I'm so glad you brought that up because that hits home to me. You also mentioned, you said the employees build your culture. Sort of what I took out of that. And they do. It's, it's not happening in a boardroom or an executive meeting. It's happening with every single person. And let the employees build your grief process. And to your point, you said what's needed today is so different than what that handbook that was written 20 years ago said.
Absolutely. And, we're in a world right now where people are grieving for so many reasons. And I think it's one of the most underrated conversations within a company. I can't tell you how many times I have conversations with HR directors and people are hurting. And it could be my child is just been diagnosed with something, or my spouse is trying to get through an addiction right now. I mean, people are bringing all of this to the job, and we can't expect that it's checked at the door. And that was the statement years ago. You check your problems at the door and you're coming in. But, we know right now this is a different world, and that product is going to suffer if we don't recognize it. Once again, as we were just saying, if people here are feeling heard and valued, they're going to perform. And it doesn't take much to hear somebody and value them on your team.
I second that motion. Don't check your life at the door. How about we open doors so I can learn how to deal with this life where I am right now? Would you agree?
Absolutely. I love that. I'm going to steal it.
You took me there. Come on. I didn't know that was going to come out of my mouth, but you took me there. And I'm glad we focused on that grief area of mental health, because I agree with you. It's one of those, I call those sort of hidden things. Sometimes I say grief and caregiving. Those are kind of my two. I don't know if you would agree. Those are what I feel are really hidden in all of us in a lot of ways.
Absolutely. Yeah, the sandwich generation right now is real. I'm living it myself. And it's a lot with modern medicine and how long people are living and, raising children. It's a lot to bring on to somebody's plate on a daily basis.
One of your values is about resilience. And we had talked a little bit about this previously too. That word resilience and building resiliency is a very popular phrase and a popular theme, when I don't know how many different lists use it that I read, and just all over that word. So I was wondering, from your perspective, how can leaders begin to look at, what are these moments of resiliency as an individual or on a team or in an organization that need to be focused on, or what are actions I can do to build resiliency? Because everybody says, yes, of course, but they don't know, well, what do I do? Any thoughts, Julie?
I think about what's happening right now in the world with federal employees going back after, could be over a decade working from home. And how does this conversation of adapting to this new way of being and shifting, as many companies have had to do, and nonprofits, we're just in this flux of constant change right now. And that resiliency piece is so critical. It gets down to how do we adapt? And what I love about the Kobe Index assessment is it really digs into, wow, I didn't really realize that I have these skills. Where I'm going with this, sometimes we don't know what's inside ourselves in regards to our resiliency tools, how we adapt to that change and how we're going to recover and continue to move forward. Companies are constantly having to do this, but as a leader of a company, that you're probably trained real well in what resiliency skills look like. but your employees may not, or they don't recognize that they have it. So how do you have those conversations about pulling out strengths? And that's what I love about your assessment is I'm walking away and I'm feeling great about myself because my strengths are being recognized. We don't need to be putting individuals down. We need to be lifting them. So answering your question, how do you identify the strengths within your teams to help build and shift as you have to adapt? And it's right around the corner. It's happening as we speak right now.
It is. And I'm glad you called out the Colbier Index as a resiliency sort of like secret almost over here that people aren't aware of. And what you just said, hey, it just gave me confidence and strength, and I can leverage or lean into my natural instincts during times where I need to adapt. I need to hold on what's true and the truth about me, because that's going to help me adapt and work through it. I believe that is a critical point of just sort of self-confidence and building our sort of self-resiliency that way.
And with that, you have your team members to lean on in those skill sets that maybe you're not strong on.
I'm going to bring you into my next Colby session and have you got it. It's how do you then look at, I can't do it all. I think sometimes resiliency, I have to admit, I can't do everything, and I need to surround myself with people that have different kinds of smarts or intelligence, different personalities, as well as then just different ways we take action. And that way together, it takes a team to be resilient and to get through changing times. And I think it's easier for an individual if they at least have somebody with them on that path through these times. Would you agree?
Absolutely. And, those individuals that may not have, what they see as a leadership role, in the end, they're still providing leadership to their team members as they're showing their resiliency. And I just think that's a beautiful thing.
We're in agreement. I love that. Well, we talked about a lot. Is there anything we didn't talk about that you wanted to bring out to our listeners, Julie?
I think through everything that we've discussed, it's just important to remember when you're leaning in with your team and your colleagues to make sure it's always done in a safe space and that individual feels safe in those critical conversations that you're having. I don't think that we talk about it enough, even if it's like calling somebody out in a team meeting for something, make sure that we're doing it in a way that is safe for them and it's providing their strengths. And if something needs to happen in another type of conversation, that it's done one-on-one. And I do hear that a lot from employees that it's not happening in a safe manner. So leaning into those critical conversations and what that psychological safety piece looks like. And there's a lot of businesses, including ourselves, that do these types of educational trainings for workplaces. And if you want to learn more, you can always reach out to MHA.
I think they should. Talk about a call to action. One thing I want to highlight, you want people that study this, have expertise in this. My background is in human resources, but a lot of this is new thinking or maybe old thinking, but new application. And you need people that really get it well to help people through that. Definitely a first call to action. But before we get to more about how they get to you, let me just do some highlights, Julie. How does that sound? We started with mental health is health, and everything we talked about in this quick conversation was around that part of our health and how to strengthen that. And one thing we started was around, we talked a lot about, and I didn't know we were going to go there, but around the Kolbe assessment and looking at 3 parts of the mind and how that can really help strengthen confidence, resiliency, connection. It tied to everything. And we say that a lot, Julie, how that tool, and that's why that one assessment is what we really are experts about, because it has so many connections to building these safe, belonging environments, because you start valuing and being able to call out in others what's not in you and what you need from others. So that's definitely a highlight. You said you need to find connection champions on teams. Who can you get out there and become a voice and to learn from? So I love that. You mentioned if you have ERGs, where's your mental health resource group? And could that be a starting ground as a way into some of these conversations? I love that because it's all about human conversation, as you said, not about, any kind of lists. It's about you need to dig in that way. One thing you talked about is around personal values and how those come up and linking those back. And organizations, you said the best organizations are leading by example, spending some time one-on-one in groups about personal values, what drives an individual, what connects an individual to an organization, what makes that individual feel safe. Because a lot of times if we're able to feel or live our values, that gives us a real sort of safe foundation to start from. So I think that's a big one. Now I'm going to recap. You talk about planting seeds, and it's all about starting with, you can't plant a seed until you ask a good question to know which seed to plant, what kind of variety. And you said it's not a snap of the fingers, but that takes a while to grow, and it takes ongoing tending. If you're trying to get to mental health issues, it's not a one and done. It's ongoing. So I love that as a highlight. So open the door to mental health, everybody, through some of Julie's learnings that way. And then we finished about resilience and building confidence as individuals and teams. And I'm glad we went there with that word and talked a little bit more about that, because I do feel it's one where everybody agrees with. You talked about how the Coldy assessment can help with resilience, but you also talked about it, tying it back to adapting, finding what is my way to adapt, and that's being resilient. And I think adapting is sort of an easier word sometimes to understand. We all adapt differently. So Julie, a lot there in a little bit of time. How can people find you, connect with you, learn more about you and the great work you're doing at Mental Health America Lakeshore?
So the best way to connect with us is via our website at mhalakeshore.org. And you'll see all the great work that we're doing within our website. And you can connect with us that way by either calling, setting an appointment, emailing me. We would love to speak with you. We work with a lot of companies all throughout the region. We have in-person training. We do virtual training, everything from C-suite all the way to construction. It's important. And mental health is health. And it doesn't matter what trade you're working in, it's affecting your employees. So let's talk about it together.
Thanks, Julie. And what you just heard, everybody, is that everybody's a good match for this. Doesn't matter what size, place, because we're humans. So if you're listening, living, breathing.
Newsflash.
Exactly. You're a match for Julie and her team. Reach out, learn more about the good work they're doing in this area. And thank you all for joining us on today's podcast. Remember, you can subscribe to the show wherever you get your podcasts and learn more at humanworks8.com/podcast. And if you want to know what I'm wondering about each week, subscribe to my Wondering Wednesday on LinkedIn. Again, I want to thank Julie for joining me today and wish everyone a great rest of the week. Thank you all. We look forward to you joining in the conversation next time. Remember to subscribe to the show wherever you get your podcasts and learn more at humanworks8.com/podcast. And if you want to know what I'm wondering about each week, subscribe to my Wondering Wednesday newsletter on LinkedIn. Reach out to us if you need a partner to navigate your humanscape or a speaker from our team who will inspire your people and challenge your leadership. It all starts in one moment. Let's bring work to life and life to work together. You got us.